urban water conservation from the perspective of what WaterAid has done. This is actually a mild departure from what our bread and butter work. Like Mr. Rajaram was saying, we are really servicing the rural and urban poor. And urban water conservation, the way we have started working on over the past few years, starting pre-COVID, has actually been an insightful, it's been very insightful for us. And it has taken us down a path which which we see there is potential and which we want to build on. And I was also recently mentioning to Mr. Vijay about the Telangana State Water Consortium. We have taken baby steps trying to put this consortium together and to share our experiences on water conservation, to consolidate it, synergize, and take it forward. So this is basically a sharing of experience. My disclaimer is that again, it may not be something new, but it's some experiences which I think we may all may all benefit from and want to implement some aspects of it in our own work, in our sort of joint objectives on water conservation. I'll take a few minutes to just introduce WaterAid. WaterAid is a international not-for-profit organization with this very broad goal. Our global WaterAid goal is everyone, everywhere by 2030 with adequate water, sanitation, and hygiene, safe water, sanitation, and hygiene. If we look at what we do, our core mission is to transform the lives of poorest and more marginalized by improving access to wash. So we consider ourselves a fairly experienced wash organization. We may not be a leader in this space, but we are one amongst the organizations who've been around for a fairly long time. We started in 1986 in India, and we've been implementing projects. We started in Tamil Nadu actually, then moved to West Bengal, and then we've slowly been able to expand our work to other parts of the country. And now WaterAid is now registered, WaterAid India is now registered as Jal Seva Charitable Foundation, which is a separate entity. So we are officially a not-for-profit entity under Section 8 of the Companies Act. And we've established that in 2020, and we've been raising resources both in India and through our federation members abroad to service our mission on wash for everyone, everywhere. We are currently present, this numbers have slightly changed. I think we are now present in 14 states and 44 districts, and the same number of cities at this point of time. And our work, varies depending on the context, depending on the requirement, depending on state priorities, and depending on what is required for the communities that we are working against. Just to give you a sense, at the beginning of our current strategy period between 2020-2025, we reached a fairly large section of population where we are working, both in terms of access to toilets, access to hygiene education, and therefore hygiene behavior change, and then of course on access to clean drinking water. I wanted to mention this particularly because we have we take very concerted efforts about tracking our beneficiaries, ensuring that whom we are servicing is well counted for, and the impact and the outcome is clearly quantified. So this is one part of our impact quantification in terms of the amount of people we are able to reach through our programs. In addition, we also work through leveraging government resources, as in whatever government schemes and priorities are, we ensure that they are channelized to the appropriate people, the appropriate communities who actually are deserving of such services. So our work is divided broadly in four verticals of four thematic areas: safe and assured drinking water at household level. Safe referring to quality of water, assured meaning a steady supply of drinking water. Today we know supply is not uniform, so 55 liters per capita per day, is that something can everyone achieve? And that's really what we mean by assured drinking water at household level. Then in the areas where we work in water, we also try to fix problems of sanitation. While we don't build individual toilets, we encourage people to build their toilets, and also allied services such as grey water, etc. Also something that we work on under the sanitation sphere. Hygiene is a bit of a cross-cutting theme. We work from improving awareness on hygiene and then moving on to behavior change with a particular design of our hygiene delivery package with multiple touch points. And we believe having done that, people would be able to opt for better change behaviors. And lastly is wash in institutions. By institutions, we mean schools, public schools, healthcare facilities, government healthcare facilities, primary health centers, community health centers, etc., and Anganwadi centers. So these are institutions which support particularly rural societies, the pillars of rural societies. If they don't have adequate wash facilities, then rural societies will not be able to be serviced better. So this is our four thematic areas. Our approach, I'll quickly go through this just to give you a sense of what we do very broadly. Our focus is to try and work with marginalized communities, because these are communities who don't have what the mainstream communities have. So many of the schemes have not touched them, welfare measures have not touched them. They are perhaps don't exist in the current system. So we try to identify them, map them, extend these services to them as well. And then there are mandated institutions created by our local governance policies framework through our empowered by our constitution. So these mandated institutions at the community level are important to be revived, and work done through them to ensure they are well managed by the community. Community participates in our interventions, so therefore it becomes sustainable. And there is a bit of technical support. By technical support, it is very low tech in nature. We provide designs of some of the infrastructure that we do, some of the solutions we have created, and we try to work with district administrations to try and replicate it. A conscious involvement of women and youth in the communities where we work in, leveraging existing government resources, policies, etc. I already talked about that, and creating a formula for sustainable solutions with community participation. And this is something that is something we have always endeavored towards. We have success in many places. In some places, it's not all been successful. So we're continuously trying to refine our model for ensuring sustainability. Um, so I thought I'll take a little bit of time to just talk about the water crisis in India, very briefly, one or two slides, and then start to focus on the urban context. So if you see, there is both groundwater and, pipe water. And if you look at these two aspects of water, if you look at groundwater, we know that the irrigation sector consumes the largest in terms of groundwater. The domestic consumption stays at about 9 to 10%, and then the industrial use is about 2%. Consequent to what many of us might think that industrial use is fairly higher, it is actually some of the least, least consumers of groundwater. Because over a period of time, there have been regulations, they've been asked to work with recycled water and so on and so forth. So there is, and in terms of their footprint also, the amount of water that they're taking as compared to the irrigation sector, it is fairly small. If you look at the urban and rural requirements of water that are fulfilled by groundwater, 50% today of urban water needs are fulfilled by groundwater. So this is the significant piece of, the centerpiece of my sort of talk today. While there are in urban areas, there is talk about saturation through pipe water supply schemes connected to the grid connected pipe water supply. We still don't have that kind of reach and saturation. And a large part of our urban populations fall back on groundwater for their domestic needs. And in rural, of course, it is 85%. And we know that Jal Jeevan missions, schemes like Jal Jeevan Mission, which have come now, are attempting to fill that gap. But urban water still, a large part of it, surprisingly, users are dependent on groundwater. If you look at the urban Indian challenge, if you see in terms of access to water, children below the age of 14, are at the risk of multiple health hazards because of lack of poor water supply. And we're estimating that at about 8 million from the National Social Survey NSSO data. Of course, this is slightly dated data, but the figure would have only been amplified over the years, the last 5 years. A fifth of the world's largest cities are under water stress are in India, with Delhi being second on the list. And there have been other cities which have gone through this day zero discussions, just like other countries like New Zealand, etc., have done. But Hyderabad was touted to be one of those countries under stress, one of those cities under stress, including Chennai and some of the others. And also 35% of urban households have individual pipe water supply in their household. So which means 1/3 of India's urban population still don't have a pipe water supply connection in their households. So just to summarize, what I shared with you as some statistics, and what are the implications of that, the water scenario. We are looking at increasing health effects like diarrhea and so on because of inadequate wash provisioning. Then we are looking at very abnormally dry scenarios, and we are looking at a lot of environmental water shocks that are likely to affect our populations. And with our one of the things that we were talking before I started presenting was about how it's a question of management and not a question of scarcity. So that's actually playing out very clearly now. Despite people talking about population explosion and so on, there's enough water if managed well. We can continue to look at everyone having at least that 55 LPCD per day. But currently, our world's freshwater resources are only at 4%. So therefore, we need strategies and technologies that will help us ensure that we give that minimum 55 liters per day to everyone.